Well, welcome back everybody to our online program, and we've been talking about the opioid crisis, specifically in British Columbia where we happen to live here. And this is a very terrible thing going on where people are dying from overdose deaths, and the majority of those have this drug called fentanyl involved. Fentanyl is a very powerful opioid. And very easy to overdose on. And people are, this year's statistics, even up to from January to September, have been 914 deaths where fentanyl was detected as part of this drug overdose problem. Another response that we've seen that's really quite interesting is trying to figure out who's to blame. So, who's to blame for this big opioid crisis we're going through? And we constantly read that it's the medical doctors. This is the cause. That the medical doctors have been prescribing way too many opioids. And this is the reason for this, right? And then a little more thoughtful commentators will talk about, well, it's not just the medical doctors prescribing, it's those pharmaceutical companies, right? Because they're advertising it and they weren't entirely honest about how addictive these opioids were, such as oxycodone. And so they're to blame because they were pushing this and advertising it. And then similarly, some other commentators have pointed out, well, not just the pharmacists and the doctors, but the medical insurance people, because, they want to save money, right? So it's a lot cheaper to pay for a pill than it is to pay for example, psychotherapy, which is long, involved, and far more costly, right? And then some even deeper thinkers have suggested that, well, maybe a lot of this has got to do with this idea we've come up with, including the medical profession, by the way, that there is no reason for anyone to suffer if there's a pill available. So it's even at a cultural level. But anyway, this is a very curious kind of thinking, right? Because, for example, I've worked with many clients who are addicted to opioids, and I can think of two that actually developed their addiction because they got a prescription from a medical doctor. The vast majority of the people I work with got their drugs mainly from the street and sometimes from grandma's medicine cabinet. Right? They just found this drug and were attracted to it, to the experience of being high on it, right? But beyond that, I mean, when we look at the research on people who are prescribed narcotics, I've read research studies anywhere from 3% of the people prescribed narcotics to 20% that have actually become addicted because of the prescription. So it's a really curious argument to make, to pin it all. And probably one of the more important things to consider is that whenever there's any sort of big social phenomena happening on, for example, this opioid crisis, that, for example, historians will typically point out the cause is not one or two factors. If you really want to understand the cause of one of these movements, you actually have to dig into the politics, into the social things going on, into the cultural things, into the economics, and a whole bunch of things, and all of those various elements then combine, in addition to things, in this case, like availability of the drug, to actually produce this phenomenon happening. The idea of pinning it all on like a single cause, like the medical doctors, it really doesn't make a whole lot of sense when we really start digging into all the issues going on. And to pin it on the medical doctors is leading to some very bizarre situations. And one of them actually happened in the United States, and it was written up in this journal called the New England Journal of Medicine, which is a pretty reputable journal for the medical doctors, right? And the story is about this medical doctor who's dealing with a patient who's dying from cancer. And it's not negotiable. The person will die in a few months, right? And she's at a cancer clinic, right? She works at a cancer clinic, and she is prescribing this patient narcotic medications, right? and a very famous one called oxycodone for the pain, because having cancer is very painful, right? And I'll just read you what this medical doctor said about working in their clinic, prescribing these pain medications for people, for this one particular person who had terminal cancer. Anyway, this is what she writes. The role of opioid analgesics, these are these opioids, has been distorted to the point where the word oxycodone uttered in front of a patient in my palliative medicine clinic is met with raised eyebrows. So even the healthcare workers raise their eyebrows if you're going to prescribe like a good dose of narcotics. But not only that, she says some patients choose to be bedbound, choose this bedbound existence as they near the end of life, rather than risk the possibility of addiction. And you think about that, and you can't think about how completely absurd that situation is. This fear that, oh my God, if I take these drugs, I'll become addicted, even though the person is near death, right? And so this is one of the issues that comes up, and why the New England Journal of Medicine obviously wrote about this, is that in some clinics, in some settings, that it's this idea of that, oh my God, we can't prescribe narcotics even to someone who's dying from cancer because, oh my God, what if they get addicted, right? It just seems so incredibly ludicrous to pin it all on that kind of thinking, right? Anyway, that's it for this episode, and we'll be back next time with our last episode on this opioid crisis.